To truly understand inflammatory heart diseases, we need a good grasp of the heart's anatomy. Imagine the heart as a house with three main layers. The outermost layer, the pericardium, acts like the roof and siding, protecting the heart. It's a double-layered sac filled with a small amount of fluid for smooth heartbeats. Next, we have the myocardium, the heart's muscular middle layer, comparable to the house's walls. This hard-working layer is responsible for pumping blood throughout the body. The myocardium is like the engine of the heart, constantly working to keep blood flowing. Finally, the innermost layer, the endocardium, lines the heart's chambers and valves, similar to the house's interior walls. This smooth layer ensures blood flows effortlessly through the heart. The endocardium is crucial for preventing blood clots and ensuring smooth blood circulation. Inflammatory heart diseases occur when any of these layers become inflamed, disrupting the heart's normal rhythm and function. Understanding this basic anatomy sets the stage for grasping the complexities of these cardiac conditions. Inflammation, a natural response to injury or infection, can sometimes target the heart, causing significant problems. When any of the heart's layers, pericardium, myocardium, or endocardium, become inflamed, it can disrupt the heart's rhythm and overall function. This disruption can manifest in various ways depending on the affected layer. For instance, inflammation of the pericardium can lead to chest pain and difficulty breathing. On the other hand, inflammation of the myocardium can weaken the heart muscle, affecting its ability to pump blood effectively. Endocarditis, the inflammation of the endocardium, can damage heart valves and increase the risk of blood clots. Understanding the specific ways inflammation affects each heart layer is crucial for nurses to provide effective care and education to their patients. Endocarditis, the inflammation of the endocardium, is a serious condition that demands our attention. This infection affects the inner lining of the heart, particularly the heart valves. The usual suspects behind endocarditis are bacteria, fungi, or other germs that enter the bloodstream and make their way to the heart. Intravenous drug use, heart valve abnormalities, and a history of endocarditis increase the risk of developing this infection. Diagnosing endocarditis involves a combination of blood cultures, echocardiograms, and a careful review of the patient's symptoms. These symptoms can be quite varied, including fever, chills, fatigue, shortness of breath, and a new or changed heart murmur. Early detection and treatment are crucial to prevent complications like heart failure, stroke, and heart valve damage. Prompt treatment with antibiotics or antifungals is essential to combat the infection and prevent potentially life-threatening complications. Myocarditis, which is the inflammation of the heart muscle or myocardium, is another serious heart condition that nurses really need to understand. This inflammation weakens the heart muscle and, as a result, impacts its ability to pump blood effectively. Viruses are often the main culprits behind myocarditis, but bacterial infections, autoimmune diseases, and even certain medications can also play a role. Some of the risk factors include recent viral infections, exposure to certain toxins, and autoimmune disorders. Now, diagnosing myocarditis can be pretty challenging since the symptoms often mimic those of the flu, like fatigue, shortness of breath, chest pain, and irregular heartbeats. Electrocardiograms or EKGs, echocardiograms, and blood tests are used to help confirm the diagnosis. Treatment focuses on managing symptoms, supporting heart function, and of course addressing the underlying cause. Antiviral medications may be prescribed if a virus is identified, while other medications can help manage heart rhythm abnormalities and support heart function. Pericarditis, which is the inflammation of the pericardium, the sac surrounding the heart, presents another set of challenges. This inflammation can cause chest pain, often described as sharp and stabbing, and it tends to get worse when lying down or breathing deeply. The causes of pericarditis are pretty diverse, ranging from viral infections and autoimmune diseases to certain medications and even radiation therapy. Risk factors include recent viral infections, chest trauma, and some medical conditions like kidney failure. Diagnosing pericarditis involves a physical exam, listening for a distinctive pericardial rub, which is a scratching sound heard through a stethoscope, and an echocardiogram to visualize the inflammation. Treatment typically involves anti-inflammatory medications to reduce inflammation and pain relievers to manage discomfort. While honestly, most cases of pericarditis are mild and resolve with treatment, some cases can become chronic or lead to complications like cardiac tamponade, which is a life-threatening condition where fluid buildup around the heart compresses it and impairs its function.